Hello, and welcome to Healthy Living. I'm Dr. Donald Pelto, and I have Dr. Karen Way here with me today.
Hi,
so
Don.
thank you, Karen, for joining us.
Thank you for
in Healthy
having me.
Living. So today we're going to talk a little bit about health. That's the name of the show. And I'd like you to tell a little bit. You're a chiropractor, and
Yes.
what's some of the best health advice that you ever received?
Oh boy, that's a loaded question. So I've actually had up 20 some odd years of being in practice, and over the years you get a lot of advice.
Yeah.
But when I first got into chiropractic college, one of the best advice that I was given, or it was actually, I would say it was a phrase or a statement from Thomas Edison, and it really sums up sort of the foundation of my practice and my philosophy.
Yeah.
And that is, the doctor of the future will give no medicine,
Wow.
but will instruct his patients in the care of the human frame, in diet, and in the cause and prevention of disease.
Wow. So that's the importance of preventative medicine that we hear about.
Right.
And is that feasible? Is preventative medicine, that's what you do, I guess, so it is feasible.
Yes, it takes work though,
Mm-hmm.
because we really do live in a toxic world at this point with industrialization and all. So in order to stay well, it is actually really important to be proactive with your health.
Okay.
And really work on your lifestyle and your diet.
And I feel like so many people these days aren't very proactive. They really want just a pill to take care of everything,
Mm-hmm.
or a shot, or some type of a solution that they don't have to do anything. There's
Yes.
really no personal interest or personal work on their end of things.
Yes, I think that in many ways, Western medicine has its place, but it's also kind of trained us to just want a quick fix.
Yeah, yeah. And we're going to talk specifically, because we could talk about a lot of different things, and I think we've decided prior that we're going to talk about intestinal health.
Yes.
And for those that are watching, the intestines you can't see. We're going to talk a little bit about why is that so important? What is intestinal health, and how did you get interested in that?
So along the way, when I was in chiropractic college, initially I had a purely structural approach.
So that means you adjust people.
Yeah,
That's
so
okay.
basically as a chiropractor, our focus is on the health of the spine,
Mm-hmm.
and we look to optimize movement of the spine so that we can have optimal nervous system function.
Okay.
And that the nervous system is sort of like the electrical system, and it goes and sends messages to all of the other organs and cells in the body. So that's the focus as a chiropractor. But early on, one of my roommates was an upperclassman. He was going to be graduating shortly. He asked me if I wanted him to do some work on me. So I said, sure. And he was doing some very different work. That introduced me to the concept of the fact that the structure was affected by factors other than the structure. It wasn't just a purely biomechanical system, that there were other things that were interplaying.
It wasn't just your spinal health.
It wasn't just the spinal health. And that for the most part, the nervous system goes the other way as well. So that if your intestines or any of your organ systems aren't functioning optimally, they can refer to the spine and then create subluxations. So that nervous system actually goes both ways.
Wow.
So I got interested in that, and I started studying acupuncture and other things, and just really was fascinated by the importance of the intestines and the role that it plays in our overall health.
For a little bit, I remember that the intestines have a lot of nerve innervation, we call it, or nerve connections.
Yeah.
And I think sometimes, for example, if you're feeling nervous or anxious, you feel it in your gut.
Absolutely.
Is that one of the things that you're talking about?
That's one of the connections. Yes, so a lot of people don't realize that 80% of our immune system stems in our intestines. So it regulates our immune system. It also helps to break down all of your food to tiny particles and nutrients so that your body can then reabsorb all of that goodness and use that for energy, so that cells have fuel. Other things that the intestines do is it actually helps to activate vitamin D. We get vitamin D from the sun, but it's in inactive form. And it's actually the intestines that will activate that vitamin D.
Interesting.
It houses all of our microbiome. And
what's for those that are watching?
Yeah,
what
so
a microbiome is.
those are basically good intestinal bacteria.
Okay.
And for the most part, we've got millions of bacteria in our body.
Good bacteria.
And we do have harmful bacteria as well, but the more good bacteria we have, that's again our immune system. It helps us to protect against all of these factors that come in that want to like chip away at our immune response.
Okay.
Yeah, so viruses and toxins and all of those sorts of
Antibiotics
things.
that we give people.
Yes.
They
That kind of
probiotic.
decrease the counts of all of our good bacteria. Yeah, exactly.
And then in terms of the biome or your intestinal health, how do I tell how my intestinal health is? Are there certain tests you do? How do you evaluate it? And then we talked a little bit about cleanses. People are talking about these juice cleanses or different types of cleanses. How do those work? Why are those important? Should everyone do them? Things like that.
Right. So the average person isn't going to know how well their intestinal system is doing unless they have symptoms. But there are some stool tests that can be done to basically measure not only your ratio of good to bad bacteria so that we have an idea if there's an infection or yeast overgrowth of yeast or certain organisms, but it also helps us to map out how effective is our digestive system working. So from hydrochloric acid levels to the amount of enzymes, fat metabolism, all of that is mapped out from the mouth all the way down through the stool test. And even has markers like precancerous markers, and et cetera. So it's really fascinating stuff.
Okay. And then how are these cleanses? Who should be doing cleanses? How often? How do they work? Tell me a little bit about that.
Yeah, so I think for the most part, everybody should do a cleanse yearly, at least one a year.
Is that like a fasting or water cleanse?
It's not fasting and it's not water, no. I mean, essentially the way that we like to do it as physicians is we like to do it in a safe way. It's not too extreme. And so basically it's about changing your diet in a way in which it's more anti-inflammatory and clean. We can get into that later if you like. And then as you're eating a cleaner diet, we then actually give supplements that will help your digestive system function better. So from, increasing your hydrochloric acid levels for a little bit of time, helping your liver to detox, helping your gallbladder to work better, all of these organs associated with digestion. And then later in the program, we would give product to help re-inoculate or give more good bacteria to the intestines. So strengthen digestion, decrease toxins, and then re-inoculate. That's the basic
process.
Steps. Yeah.
And how would someone feel before and after something like that?
So a lot of people that go to the length of doing stool tests already have some kind of symptoms, or their health their health may not be optimal. So they may have digestive symptoms, anything from constipation, irritable bowel, just pain, bloating, or they could even have, other symptoms like skin rashes and acne and headaches, etc.
Yeah, so it can show up on your skin.
It can show up in all different ways.
So you brought some examples. So how would these are some examples of how you help treat patients? So you want to explain? Is this a cleanse here, a typical cleanse?
This is sort of a typical cleanse, exactly. So the diet is an anti-inflammatory diet. So the goal is to decrease inflammation coming into the body. So it's a lot of clean food, no processed foods, decreasing sugar, increasing your water intake, optimizing a healthy lifestyle. So we want to make sure they're hydrated, they're sleeping well, they're managing their stress well, all those sorts of things. And then what we do is we will try to strengthen how the body breaks down the food. So we'll give a little gallbladder product, the GB Support. We will give the Total Digest, which is an enzyme and hydrochloric acid product. So that's going to help you break down your food while you're decreasing inflammation. And then this yeast mycin is to help to lower some of the counts of bad bacteria. And at the same time, you would be substituting one of your meals with the shake here, which helps the liver to detoxify, because the liver is an overburdened organ with all the toxins in our diet and our environment. And this is the later phase of re-inoculation.
Of giving yourself a probiotic. Interesting. And then this should be done yearly? This is what people do yearly?
Yes, I recommend seasonally, like after the summer when we've had lots of cookouts and festivities and we eat more ice cream and all those sorts of things, then I like to do a cleanse before the fall. So right now would be an ideal time for most people to do a seasonal cleanse.
Interesting. And so that's for intestinal health. And then how about for overall health? What are some of the best health books that you refer to your patients? What do you recommend they read if they want to learn more about doing this on their own, if they want to learn more about different types of health issues?
Right. I think, one of my favorite books that I always go back to and I've read a number of times is called Perfect Health, and that's by Deepak Chopra. And that actually introduced me to an original form of healthcare called Ayurveda.
Okay. I'm learning something
And
new here.
yes, that goes back over 5,000 years to India.
Okay.
And is the original healthcare system that exists.
Wow.
Right. And so I love that book because it really helped me to understand people on an individual basis, meaning that it understands that every person has their own specific body type or constitution that makes them unique.
Okay.
And that any program that I would give would be based on your specific constitution and your specific imbalances.
Okay. Okay.
So say, for instance, there's one constitution that is called Vata, and that's sort of somebody who's airy and light and spontaneous and bubbly, that kind of personality, kind of a smaller frame. And then there's another constitution that's called Pitta, and that's a fire constitution. So they're sort of, average frame, but very, driven and motivated, and can have a little bit of an intense personality, get irritated pretty quickly. And then there's Kapha, which is a very laid-back constitution. So real earthy. They don't ruffle very easily,
Okay.
and so they're actually more prone to more chronic illness like diabetes and hypertension and high cholesterol. So basically, when you understand somebody's makeup, you understand how to get them well and how they would have a predisposition to certain types of imbalances.
Wow.
So say a Vata person would have more tendency toward insomnia, anxiety, dryness, flow irregularities like constipation or menstrual issues. And somebody who's more fiery or the Pitta constitution has more tendencies to inflammation, those sorts of things. And then a Kapha person, like I said, would be more like obesity, high cholesterol, those sorts of things. Yeah, and so I like patients to understand themselves. Like a lot of what I do is education. So I will recommend that they read that book because then I will educate them, but they'll also have a reference to go back and say, oh, I get it. This is why I'm this way. And this is what I need to do in my lifestyle and in my diet to help me stay balanced, specific to your constitutions. Yeah, so I love it because it's very individualized. It gets into specific foods, how much water each constitution might like, how much sleep each constitution might need to have optimal health, etc. Lifestyle, forms of exercise, like all of that is very specific to your constitution.
Wow. Yeah, that's very interesting. So let's give, are there some general overall, how do you say, kind of tips that you could give on being healthy?
Let's talk
about
just generally
just
speaking.
Some general ones. Yeah, we've talked a little bit about this for intestinal health. If you want to give some general intestinal or just overall health tips that you give to your patients, what are your best tips?
I think overall for everybody, the best advice would be to eat as naturally as possible. So cut out or reduce the processed foods.
Okay.
There's just too many toxins coming into the body through chemicals, colorings, additives, hormones, pesticides, antibiotics, all of that. So if you try to eat organic, try to eat as close to nature as possible.
Okay. Yep.
Hydration, a lot of people are dehydrated, so up your water, exercise regularly. Try to optimize your sleeps.
Sleep is a hard one.
Sleep
right?
is a hard
'Cause
one.
It's distracted
It's
sleep.
huge.
It's the phones that you're looking at and things like that.
Absolutely. Yeah, exactly. And just just trying to achieve like an overall healthy lifestyle with some kind of structure and routine and have it be a normal part of your life is probably the best advice that I could give. So stress management is huge as well.
I think stress is a big
So
thing.
big, yeah.
And if people, if they want to, any other last minute kind of tips you want to give them, or if they want to learn more, how can they learn more about you and about what you do?
They could always go on my website. That's www.drkarenway.com.
Nice.
For the most part, they could also call the clinic. I'm happy to chat with anybody and answer any
Good.
questions,
Yeah.
general health questions if they have it.
Yeah.
But my website's somewhat of a source to have people get an understanding of kind of what it is that I do. But I would say that in general, my focus is to not only, like I said in that original quote, is to get the structure in your frame healthy, to have a healthy lifestyle. It's really about prevention of disease and paying attention to diet and lifestyle.
That's perfect. And I think you're helping I've heard a lot of good, I've sent as a podiatrist, I've sent a few people and they've been happy. They're like, wow, she talked about things that no one else ever talked to. I think you probably get that a lot.
Yeah,
People
I do,
say,
and I love it.
How come no one's ever asked me that or thought about that? That's where I think the key is you're able to deal with things, I guess, in the non-traditional way where you ask these questions about people's overall health.
Exactly.
And usually what I find, they've already tried everything else. And by the time they
100%.
show up, you get the more challenging ones, I think.
Absolutely. Yes, it's true, but it also makes it very rewarding.
Yeah, you can help.
Yeah, to change the course.
Well, good.
Yeah,
Well, thank you
love
for
it.
joining us, Karen.
Oh, thank you, Don. Appreciate it.